Hey, Dr. Tracy, board certified general pediatrician, and this is ADHD Basics Part 3. In Part 1, we talked about what exactly is ADHD, how to understand your child, and things that you can do as a parent or caregiver to help support your kid at home and in their life. Part 2, we talked about non-medical management of ADHD, such as therapies, vitamins, nutrition, sleep, all of those things that help create a good base for a child who has ADHD. In Part 3, we're going to talk about pharmacological or medical treatment of ADHD. I'm not going to delve too in depth to each medication because that really should be a discussion with your doctor. And these videos can get really long. And so I know that if you're like me, I only pay attention for a few minutes anyway. So let's talk basically about why they would be used and what are some common misconceptions. So first of all, a medication would be used when it is indicated, when the person is struggling in more than two areas of their life and all other interventions are not working, then it is appropriate to use a medication. And so if you think about a child who is struggling to read and their vision is terrible, you can do all the interventions you want to all day long until you put a pair of glasses on the child. You're really kind of spinning your wheels. All of a sudden you put a pair of glasses on. It doesn't mean you stop doing all of the work. It just means that the child can show up and do what it is they need them to do. So that's how I like to think of ADHD medications. And I try to help parents get to that place as well. We're also trying to build strong pathways in children. We are not trying to create compliant children and well-behaved children. We are trying to lay down pathways so that we have healthy, successful adults. That is the whole point of all of this. And so it's not just to get your kid to sit still at 8, because I have a lot of parents say, well, I don't mind that they do all these things. I don't want to just medicate them. I love who they are. Absolutely, you love who they are. Who they are is amazing. We're not trying to change that. But if they're taking in information in all different chaotic ways and it is impacting their ability to learn, their social life, their safety, they're constantly getting in trouble at home for things they're not in control of, and nothing else you're doing is helping or not enough, then medication is just helping that child take in the information a little bit better, have a more structured brain. And then the goal, again, is that as the child ages, they are forming these pathways so that when they become an adult, they go, okay, this is what I need to do when I need to pay attention. And we're not treating them for anxiety and depression when they're adults because their ADHD wasn't treated when they're a child. So don't think that if your child needs medication, that is somehow a failure of you, the child, the teachers, the medical community. It is just like if you needed to use a maintenance inhaler for asthma because the asthma wasn't being controlled by other means. So that is how I like to present it to parents. That's how I think about it as a pediatrician. I don't think of it as anything negative. I just look at, is it needed? What is the best medication that might be used? Get the parent on board, help them understand, get the child on board if they're old enough, and work with them to cause minimal side effects with the most benefit. So no, we do not accept children who are not themselves. We do not accept that. If we know about it as providers, we will recommend changing the medication. What I like to hear is the child says, I don't notice anything under a certain age, where they go, I don't notice anything, but the school is noticing they're able to learn a little bit better. The parent is noticing that they're able to focus and pay attention. They're not having as many behaviors. So that is ideal, is that the child does not even notice that there's a difference. When they get older, they will sometimes tell you, oh, I can tell when I take it versus not. But I don't like to hear that all the time. So the two classes of medications that are available right now are non-stimulant medications and stimulant medications. Again, one is not better than the other. It depends on what is needed for your child and how they respond to it. One is not lesser. So it's not like you need to start with a non-stimulant and then if that doesn't work, go to a stimulant. Why take a medication if the side effects could be higher for your child and they may not work as well? So in general, what I notice is that stimulants work a little better if you can manage the side effects. Non-stimulants still do have side effects, don't work as well, but they work well for certain people. So stimulant medications, think Ritalin, Adderall derivatives, there's so many of them now. Those are just the ones that most people kind of understand, and that's the two classes of medicine. They are controlled substances, meaning they can be abused, but you do not need to worry about your child becoming addicted to ADHD medication if they are taking it correctly. It is used incorrectly, it can be addictive. So tons of studies now, children are less likely to have addiction in adulthood if they were treated for their ADHD as children, again, because those pathways are laid down. And if we don't support them as children and then into adulthood, they will self-medicate, and they'll self-medicate with food, overworking, other substances. They'll medicate with whatever they can to feel calm. So we want to use something that's been studied, that's been looked at, that we can control the dosage. So again, it's been disproven over and over again that stimulant medications contribute to addiction. They do not. You just need to manage the side effects. Make sure your child tolerates it. Make sure they feel comfortable. They still have the ability to get all that energy out. They still have that lovely, wonderful personality they have. Some kids take them for a year. Some kids take them for 3 to 4 years. Some kids take them for their life. It really depends. Dosage is also interesting. I find that some parents are like, I want the lowest dosage there is and I don't want to go up. I have had very small children with mild ADHD need very large doses of ADHD medication. And then I've had larger children with really mild ADHD or very severe ADHD need really, really low doses. They can't tolerate anymore. So it's about metabolism, not severity, not age or size of the child. And that's another thing to remember. Some people are fast metabolizers. They get these medications out quick. And so that's what we're looking for. We're looking at your child. How do they respond to these medications? How are they growing? How are they sleeping? All of those things. So they do require frequent follow-ups because of those symptoms that we're trying to manage. Once the child's on a medication, their maintenance, they're doing well, you can space them out. Non-stimulant medications are not controlled substance, but again, that does not mean they're safer. It just means that they're not abusable by someone using them illegally, and so they're less likely to be controlled by the Drug Enforcement Agency. You can get refills on them. You don't have to follow up as often if your child is tolerating them well, but again, they don't always work as well, so it's not necessarily better to start there. So talk to your pediatrician, psychiatry provider. Find out what might be the best option for your child. Ask the questions. Keep your mind open. Understand that if we treat ADHD through the whole child, the whole body, their environment, medications are a part of that. We never expect it to cure anything, and we never expect it to be the only answer, but it's not wrong to use it. So we'll do part 4. But this finishes up anything with medication. If you have specific questions, talk to your provider. Take care.